Welcome back. Back in January, I told you about my family getting COVID-19, all of us, including my mom. And I was frightened for my mom, who is now 72. She's a type 1 diabetic. Thankfully, she ended up with a mild case. As soon as she tested positive, I knew that she was a candidate for a monoclonal antibody infusion treatment. I talked about it then, but here in Indiana, we haven't really been talking about that much, these therapies lately. So now today we are. Dr. Mark Williams is the Senior Medical Director of COVID-19 at Lilly, and he's here to answer my questions. So good to see you.
Morning, Angela.
And yeah, I know that it's important, first of all, as everyone is, to make sure that we talk about the vaccine and that is, something that we want to focus on. But when it comes to these other therapies, I feel like we haven't been talking about them really in the last several months. Tell us what they are.
So monoclonal antibodies are man-made antibodies that actually were derived from patients who survived early on from coronavirus. So they're man-made. They have almost immediate effect. When you become sick with COVID, your body has not yet had time to make your own antibodies. And so if you have advanced medical problems and you're at high risk of developing severe COVID, it's important to get those in quickly because your body simply has not had time to make its own antibodies.
What right now, for someone who is going to hear this and maybe they are vaccinated and they say, well, I wonder if I would be a candidate for this. Is it just for those who are not getting a vaccine? Who can get one of these therapies?
So these therapies are authorized for patients who have COVID and who are also at high risk of developing severe COVID, meaning you might be at risk for hospitalization. And so it's really any patients who have COVID who fall into these high risk categories, which simply are you have conditions such as your mother has diabetes, or you have cancer, or you have a problem with obesity, or you're over 65. Those are all high-risk criteria that would make you a potential candidate if your doctor approves.
I didn't put this in a lot of times we talk ahead of time and kind of give some of the questions we think we might ask, but sometimes when we're talking live, it makes me think of something else. High risk, is there testing going on or more research going on that maybe someone who isn't considered high risk, that they at some point will be able to get this, that we're finding that therapies are working and that they are safe, or are we not there yet?
I think it's still early in this pandemic. We feel like we've been living this for years, but it really is just relatively a few months. So we are learning about, hey, are there new tests that we can develop to say, these are targeted therapies for this patient at this time. We're not there yet, but the research is ongoing, certainly.
So if you get a positive COVID test, is it paramount that you get this therapy quickly? And how do you talk to your doctor about it and say, hey, am I a candidate?
So monoclonal antibodies work best if they're given early, and so we studied them that you had to be within the first 10 days of your infection. But we know from our data and other data that you want to get them in as soon as possible. So there's really a couple things to focus on. How do you get the therapy? Number one, work with your healthcare provider and talk to them and advocate for yourself, for your loved one, because that's sometimes needed. And number two, do your own research. You can search on the internet for monoclonal antibodies, infusions, and how to combat COVID, etc. So there's lots of tools.
I found these too. Your crew sent me these, some great information. I was on the Tonight Show with Jimmy Fallon because I didn't even go to try to pronounce. I want you to say, what are the names of the therapies? Do you guys have one or two or three now?
So we have two monoclonal antibodies.
Okay, and they are?
Bamlanivimab and Etesevimab.
Okay, and why are they hard to pronounce?
Just because they're antibodies, and that's what we do, right? That's how it works.
Whenever they come up to me, I'm like, bam. I don't want to say it, but it may have saved my mother's life. So I want to thank the doctors and the scientists for being able to get something out that could help her before she was able to get a vaccine. She wasn't able to get one yet. So thank you for coming in.
Thank you.
And there's more information. We're going to have it too at fox59.com to more about this treatment and links to sign up to get more information. Fox59.com. Click on Angela Answers. Jim, they have some great information here that really explains how it works and what they are, and I found it very informative.
All right, thanks a lot, Angie. Certainly getting answers for a lot of people out there. 8:46 and good Wednesday morning. We are enjoying sunshine, and much like we had on Monday, really Sunday, actually Saturday, Sunday, Monday, and Tuesday, more of this sunshine in the forecast today. It is dry out there. It is a really